Hello, everyone, and welcome to the Creating and Strengthening Park Prescription Programs, a three-part webinar series. My name is Zarr, and I'm going to be moderating this webinar for you today. Our webinar today is part 2 of the three-part webinar series on needs assessments. Some of you may have attended the previous webinar on partnerships on September 28th. Today, what we're going to be talking about is needs assessments and why conducting assessments are important and how they can help make the case for integrating a park prescription program within your agency's work. We're also going to be talking about how to conduct a needs assessment and how you can use the results of your needs assessment for park prescriptions. First, I'd like to acknowledge that this three-part webinar series is hosted by the National Park Prescriptions Initiative, which is led by the National Recreation and Park Association, the Institute at the Golden Gate, and the National Park Service. The Institute at the Golden Gate organized this webinar with support from a grant from Kaiser Permanente Community Benefits Northern California region. A big thank you to Leah Casa, who is the Health Fellow at the Institute, for organizing this series. Just a few logistical items. What you see on your screen, in order to hear the audio, please call the number that you see in that first bullet there. All of your phone lines are muted. In order to download a PDF version of these slides, you'll notice on the right hand of your screen a handouts panel. And there is a PDF available there for you. In terms of questions, if you have any problems during this webinar, please visit the website, the link that you see on your screen there. And with regards to questions, we do have a Q&A portion for this webinar, but please feel free to type your questions into the questions box, and we'll be able to track those throughout the webinar. So to go through our agenda today, we're going to be starting with introductions, then we're going to have the panel presentations followed by Q&A. And to introduce our speakers, as I said earlier, my name is Zarr, and I am the Vice President of Health and Wellness at the National Recreation and Park Association, and I'm also very much connected to the National Park RX initiative. I'm really pleased to introduce our three amazing speakers. First off is Charm Lindblad, who's the Executive Director of the Prescription Trails New Mexico program. Following her, we will hear from Dr. Robert Zarr, who's Director of the DC Park RX program and a pediatrician with Unity Healthcare. And finally, we'll hear from Suzanne Tugman, who's the Director of Community Outreach at the Kinixu Land Trust. But just to provide a little bit of background about the National Park RX initiative, which began in 2012 when a group of partners got together and we started noticing that a lot of local park and recreation agencies, national parks, even state parks, were linking up with healthcare providers to improve individual and community health. And so this group got together and we convened experts from across the country, and we continue to convene. This group has really grown since then, and that was born into the National Park RX initiative. Some of you who attended the first webinar may have heard a brief description of park prescriptions, but for those who are unable to attend, park prescriptions are programs designed in collaboration with healthcare providers and community partners that utilize parks, trails, and open space for the purpose of improving individual and community health. The beauty of park prescriptions is that it really connects people to places and spaces that help them get healthy right in their backyard, in their park. And today, especially as we're talking about health equity, low-income populations, and obesity rates and health disparities, this is really important. It's getting people healthy right in their backyard. Is accessible and affordable, and especially today we hear a lot of things that people aren't feeling comfortable going to their neighborhood gym or they might not be able to afford it, or they might not have transportation to get them to places where they can get healthy and fit. So park prescriptions is a great option for getting patients healthy. And what we've also noticed through the initiative is that programs vary across the country, which is actually great. But what they all share in common is that the benefits of their programs are vast, and we're seeing the physical, the mental, and the social benefits of park prescription programs. And we're going to be hearing from 3 community experts about that. A little bit about who's on the call today. All of you provided some background about yourselves, and so what you see on the screen here, about half of you come from a parks background, 20% are from the public health and medical sector. In terms of the stage of park prescription programs, many of you indicated that you're interested in learning about and starting a new park prescription program, and about 40% of you are currently creating or already have a program. And then you see on the screen there's what some of the most common challenges are in terms of creating or implementing your program. And it looks like partnering and funding came out on top. And so now we're going to move into our first presentation. And this presentation, which comes from CHARM, meets our first learning objective, which is participants will learn how other communities have used park and trail assessment tools to inform and develop their park prescription program. So with that, I'm going to turn the presentation over to CHARM.
Thank you, Zarr. And, oh, there we go. Okay, just to clarify, my role with prescription trails has really been, over the past 8 years, managing and advising for prescription trails in New Mexico and helping other communities throughout the country. So today, my presentation will be about the Prescription Trails program in New Mexico, why we developed the tools for our program, who we developed the tools for, and how the tools are used. It's not advancing. Let's see. Next slide, because it's not advancing. Here we go, maybe. There we go. Okay. So as you can see on this slide, our mission is really designated and focused on healthcare professionals to prescribe physical activity. So to do that, we developed 3 prescriptions: English, Spanish, and our pet prescription at the very bottom. And then on the far right corner, you can see our park assessment worksheet. And then in the lower right corner, our walking guide, as well as our website. And I will go over the prescriptions and our assessment tool throughout the presentation. So we developed these tools to assist healthcare professionals. And what we did is we use our established infrastructure here in our community, such as parks and trails. And we basically focus on walking and wheelchair rolling. But the prescriptions can be used for anything like biking or swimming, other physical activity. Because for us, our target audience, as far as walking and wheelchair rolling, are really people with chronic health conditions who don't even think about the outdoors, such as parks or open space, as a place to be physically active or as a healthcare resource. So these tools were developed to help reduce the barriers for both the healthcare professional and the patient to provide a place to walk. So our program has basically 2 main elements. First, we developed and standardized the prescription for the healthcare professional, and then we developed the criteria and standardized that basically from the American Disabilities Act for our parks, and then we standardized that in our assessment tool. Preparation and assessment for any program is really critical. And so when we think about healthcare professionals for our program, we include not only physicians, but podiatrists and midwives and dentists and veterinarians. Make sure you bring in park and rec folks, not only local, but county, state. Very important to have them as partners. If you have a national park in your area, talk to the ranger. See if you can't collaborate with them to get more people out to that park. Work with your school districts, your health plans if you have them local. They're always looking for community projects. Be sure your mayor, city council, local officials are on board. And if you're lucky enough to have a college or a university in the area like we do with University of New Mexico, we have partnered with them over the past 5 years. And the medical students always need projects. Students in any setting needs projects, but we've partnered with them and they have provided us with over 5 years of in-kind service on different projects such as assessing parks and trails in different New Mexico communities, redoing our website, and they always are even developing walking programs at clinics, and they always have fabulous suggestions. So be sure you also collect and assess what programs already exist in your area, local as well as national. How can you support each other, work together, and what built infrastructure already exists so you don't have to start from the very beginning? What training do you need to do? How are you going to grow your program? And you definitely need champions. So now I'm going to go over in depth our park assessment tool, because evaluation and assessment of our parks and trails for our program is very critical. And so this assessment was developed by the National Park Service Rivers, Trails, and Conservation Assistance Program, one of our fabulous partners. And Attila Baladi, who is a National Park Service ranger here in Albuquerque, we've worked together on the Prescription Trails program since 2006. And so our park assessment tool is based on the American Disabilities Act, and we identified the standards and criteria that we expected from our parks for our program. And we did this so healthcare professionals can feel more confident about writing a prescription for their patient and prescribing the right type of physical activity based on the patient's medical condition, suggesting the appropriate park or trail and the appropriate grade level for that person. We've tried to have at least 3 parks or walking trails in each zip code or area of the community that support physical activity where people live, work, and play. So given our target audience of people who don't even think of the outdoors as being for a place to be physically active, safety is a very important part of the assessment. And think about, tree roots and cracked sidewalks are really not good for stroller moms or seniors or everybody in between. So when people go out to a park, they need to know what to expect, and they need to have a good experience or they won't come back. And so think about parks as more than just sports fields. Think about them as a reflection of the health of your community. And so our park assessment worksheet includes many other things, such as public transit stops, the width of the trail or the path, the trail surface, parking, etc. If you look at the bottom of the screen, you see our 3 grade levels. Grade level 1 is ADA accessible, good for everyone. Grade level 2 may have a surface change, such as pavement to grass or grass to crush or fine rock, etc. And grade level 3 will have a slight incline or decline, but not more than 5%, because we want to make sure that people who have a medical condition and are possibly on a walker or a wheelchair can navigate those paths. We also provide training about this worksheet. We go out to parks with folks who are interested in starting a program in their community. We train them about all the elements. We go through all of these. We look at what works, what doesn't, what needs improvement. And we found that not all parks meet our criteria. We also review designated prescription trail parks periodically to ensure that the trails are well maintained. And we have used this park assessment tool for healthcare facilities, such as determining walking trails around hospitals and clinics for their staff and patients. We've used it at schools to provide walking trails not only on school grounds, but around school grounds, connecting the neighborhoods and local parks. We've used this for state parks in helping provide additional information about handicapped access and trails, and for employers at Sandia Labs for their employee wellness program. So this tool can be used for many different purposes. If you look at the photo, it's one of our parks, Tigweg Park. We've designated at a grade level 1. It's marked as that. It's good for all users. We also developed a training program for our healthcare professionals about the tools, what we developed as far as the prescription and the assessments, and how easy it is to select a trail or a grade level appropriate for the patient. And actually why it's really important for that healthcare professional to prescribe physical activity and support community wellness and health benefits of parks and trails. We also standardized our prescription. It's very straightforward in design. It develops a shared goal with the patient, talks about frequency, duration of activity, and follow-up. Here is additional information from our park assessment worksheet about Tigweg Park. As you can see, we add the information about the distance, the grade level, attractions, and amenities. And all of that is from our park assessment worksheet. Here is a page directly out of our walking guide, as well as what is shown on our website. And then as you're establishing or thinking about a program, what can you do to establish your standards and criteria and help make that link for parks and health in your community? You can ask your own doctor, veterinarian, or dentist to prescribe for their patients, or maybe even you. And after assessing a park, if you find that it needs improvement, what we did is we developed an Adopt a Park program for local business so that they could adopt a park, get credit for it, and that money would go back into improvements for that park so that maybe additional trees, maybe a new bench, possibly repairing a water fountain or cracked sidewalks. So there are many different opportunities for the funds to help improve parks. And that's it for me right now. Thank you.
Thank you, Charm. We're going to go ahead and move to our next speaker, Robert Zarr, who's going to cover our second learning objective. Participants will learn how to assess green space and use park prescription programs in a clinical setting. And I'm going to hand it to you, Robert.
Great. Thanks so much for the introduction, and thanks to Leah for organizing this, and thanks again to everybody who's participating on the call. So I'm going to see if I can advance the slides here and get moving with you guys. So I'm going to dig right in and go really into the partnerships that I feel are really important with the park agencies as well as with the healthcare provider organizations in using technology, the role of technology to take park attributes and put it into a format that is friendly, user-friendly for clinicians, and embed that within the daily routine of the doctors and health providers and health professionals and within the electronic health record. So here are some of the organizations that I partnered with in addition to the usual players, which would be the park agencies and the healthcare provider organizations. So far, what have we been able to demonstrate here in DC, also now in the Northeast regionally, and hopefully soon in other parts of the country, is the use of a standard park rating tool. And that Charm's already kind of described in much greater detail what that involves. I'm not going to go into a lot of that. What we've been able to do, though, is successfully work with the park agencies to actually take these park attributes, as I said, and many of these agencies, park agencies, already have really pretty useful, wonderful websites, but it's usually not in a format that is easily prescribable to the clinician. So we've taken that and we've actually those attributes and we're putting them into our database that I'll show you in a little bit, and making them really easy to prescribe for the clinician. We went live with this in July 1st, 2013, and at Unity Healthcare, that's where I actually practice. We've done already over 1,700 prescriptions. We have now expanded, as I said, to our region. We have CCI, another federally qualified health center, Children's National Medical Center on board. And so we have a catchment area of about 200,000 patients able to prescribe PARC prescriptions to a little over 300 providers at this point. So my intention from the very beginning was to make a scalable model of PARC prescription that would be relevant to any urban area that has a population either with a propensity for chronic disease or has currently a chronic disease, and where you find green space that is either very low cost or free for people living in that area. So what we've been able to do is demonstrate the steps that one needs to do in order to get to where we are today, which is the ability to actually prescribe PARCs through the daily routine of seeing patients in a clinical setting. So the first thing that I recommend is having a meeting, asking for a meeting with the CMO, sometimes the CEO, and if you can get the Chief Informational Officer there as well, it's always a really good idea. And this is, the executive leadership of a hospital, health center, group practice, et cetera. And to that meeting, it's really, I think, important to invite your a trusted PARC partner in this. So your PARC agency or agencies, that would be actually the geographic area where patients would likely be able or willing to use that space. Those agencies need to be represented in this first meeting. From there, what I have learned is that it's really important in this first meeting to do two things. One is to really make the case for evidence-based, scientific evidence-based approach to using nature, not just for recreation, but for actually human health, and showing the connection between human health and nature. The second is, once you've got them on board with the science, is to say, look, this is how easy it is to use. And literally, you'll see, jaws drop at how easy it is, frankly, for their health professionals in a variety of different health settings, from inpatient to outpatient, to be able to use this on a daily basis. The next step is to actually have this meeting, another meeting with the GIS officer, the data person for the PARC agency, to actually get those attributes into the database of PARCs, which for us in our region right now is dcparkrx.org. Once that's done, it's important to create a locale for that, so that when the doctors and health professionals are prescribing PARCs, they don't have to search through a database of thousands of PARCs. They can narrow it down to 200 or 300 for their region, or a dozen for their region, that are most pertinent and relevant to where they practice, those doctors practice. The second is to actually embed that website, the database of PARCs, dcparkrx.org, inside their EHR, and I'll show you what it looks like in just a second. The next one is to ask for and get the screenshot or screencast within that electronic healthcare records from the information officer of that healthcare organization, so that you could use that in the next step, which is to have an in-service, a training of an all-staff meeting of that healthcare organization. And it's at that meeting that I recommend taking posters, stickers, whatever you have to distribute to the staff, so that they can be able to decorate their health center or their hospital with the kinds of things that we want them to remind both the providers and the patients of the importance and the connections between health and human health and nature. And the last step is to follow up with, if you created some PARC champions along the way, which often is what happens at these all-staff meetings, or with the executive leadership of that healthcare organization. So we're really down to 1, 2, maybe 3 steps, but in many cases actually 1 step away. So here is a screenshot of an electronic health record called Centricity, and all the docs and healthcare professionals in that place need to do, and this is a fairly large system in CCI where they provide thousands of visits a year of care, is just literally type in .parkrx. When they do that, what opens up for them is the actual PARC database, and you can see it here. And then from there, they can filter their search, going from 821 PARCs, for example, down to 17, and even fewer, by actually filtering out what it is they're looking for within this huge database, or PARC formulary, as I often call it, to get them down to really just 1 or 2 PARCs that are the most appropriate PARCs for that patient at that moment in time. Here's an example of a PARC page. This is Calorama Park near where I work. And the photos are really important. Having high quality photos are really important. And how to get there, what to expect what to expect to find when they get there, the map, and some basic symbols are really important to be able to either hand, email, text your patient once you're done. So in this particular EMR, we worked with a number of different electronic health records. This one is Centricity. When you type .parkrx, which is a quick text function, it actually also automatically documents in the electronic health record that you provided a Park prescription that day, which is really one more step that we want to eliminate for the doctors to have to do. So, people often ask me, so what's the flow like? How does it work? How do you prescribe a Park prescription? And it's actually pretty straightforward. People ask me, well, I want to see your DC Park prescription program. And I say, well, there's not a whole lot to see because it's embedded into the culture and the routine of what we do every day. So what we do is just do our work and we incorporate a prescription into our daily practice. So it's important first as a clinician to recognize either a propensity for chronic disease or a chronic disease that already exists in your patient or family. The next thing to do is what we always do is understand the daily routines of our patients. Where are they during the workday? Where is the most likely moment in that day for them to be able to be active or to be just literally be in green space? The next for us is to know where their readiness is, and on the scale of 1 to 10, where are they in their willingness and readiness to actually spend more time in green space? The next thing that we do is literally link up to that database, and it's inside the electronic health record, and I'll show what that looks like in just a couple of slides. And once you're there, then you have this real-time encounter with your patient to identify the absolute best part for them, given all that you know about them and all that they're willing and ready to do. The next thing that we always do is we have a sort of a contract with them, whether it's an antibiotic or a visit to the cardiologist or a Park prescription, we want to know, well, what does that really entail? So, how many times a week are you willing to commit to this? How long will you be there, and what will you do when you're there? These are the main things we want to be able to document in our chart when we see a patient and are at the point of actually wanting to prescribe a Park prescription. And that kind of specificity is important because it's what we're going to use to follow up at the next visit. And we usually just basically say, well, when do you want to come back? When are you able to come back? And it's usually between 1 and 3 months if somebody is at risk for a chronic disease or has a chronic disease. So it becomes much more frequent in the visit structure. And then the last thing we do is share that information with the patient. So we give them a summary of the visit, or we can do it through a patient portal now electronically. We can send them that. We can share the website with them, so it's actually mobile friendly now on the cell phones or mobile devices, so it's easy to look up and remind themselves of that particular part themselves. We can also text and email it. So we have a lot of different ways of actually getting that kind of information in their hands before they leave. So this is supposed to be a short video. I hope you have a speaker on your computer and you can listen to it, but this is a real-time view of another electronic health record, and it takes 57 seconds. So I'm going to go ahead and try to play this button if I can get it to come up. Oh, yes. Let's see if I can get it to work. I'm not sure if, Leah, you have any tricks with having that show back up again. I can't seem to get it to come back to where it should be. There, hit that. So this is a real-time look at our electronic health record. You're in the treatment window right now, and you're about to hit the order set, scroll down, and hit the DC ParkRx button, and there you are. Now you're into the actual database. And I'm making it larger so you can see it larger here. And then our zip code where I work is 2009, and many of our patients work there. And then now you watch me filtering it to actually get down. This is a patient who wanted to be near basketball courts. And so we can filter it down from 39 to 14 and click on one of these so they can have a good idea, or click on all of them so they can see real quick what they look like and where they are. And then once again, here's an example of a Park page. So all this took about 57 seconds, which is very, very reasonable. It wouldn't take you any longer to make a prescription for a medication. Usually it's actually longer to write a prescription. It's longer to make a referral. So this is just as quick or quicker, frankly, than any other intervention that we do during the 15-minute visit. So I'm assuming the video ended at that point. And, as sort of a quick summary of what to do here, this is what I often leave healthcare organizations plus the Park partners when I, sort of give them an idea of what they can really do. really important step is to get that link DC Park RX into the electronic health record. And there's really no reason why this can't be done as I said, in any urban area where there's a population at risk for chronic disease, which is basically every urban area, and also where there's green space that's accessible. And partnering with your local park agencies, who would be the areas where your patients are most likely to want to be able to use, and then doing an in-service to the staff, and then reminding them to use it and following up, and literally start prescribing at that point. I have my contact information there if anybody wants to reach me, and of course we're happy to share and expand to anywhere else in the country who's interested in this kind of prescribing. Thank you.
Thanks, Robert. Lots of great information shared there. And we're going to move on to our final presentation. It's going to cover our third learning objective. Participants, having some technical difficulties. Participants will learn about community health assessment tools and opportunities for community partnerships. Suzanne?
Well, thank you very much, and hi, everybody. Thank you, Zarnaz and Leah and Robert and Charm. This has been even very informative for me, so thank you for letting me participate and share with you. So I work for Land Trust over in Sandpoint, Idaho, and we started our ParkRx coalition this last year. We did a pilot in starting September 2015 using 7 practitioners from different practices. And I'm trying to get this screen to move. Next screen, please. While we were running the pilot with these practitioners and doctors, we were able to also use some really critical tools that would help us understand what was going on in our community. Of highest note was we used the County Health Rankings tool and the CDC government tool. Those were pretty big for us. And then we also used factfinder.com, which I'll talk more about in this presentation. Next screen, please. So basically what we had encountered during the launch of our prescription park program was because we are in a rural area, we brought together all of the partners that we thought were going to be utilizing, or that we'd be able to utilize their land for trails, green space, parks, their track fields, what have you. I also identified what medical partners were interested in getting involved in this practice or in this prescription process. And then as we continued to go through our pilot, we started identifying relatively quickly that we were running into some problems with the original structure, which was asking our doctors to prescribe free prescriptions into these land-based parks and trails. And what we found was 6 out of the 7 pilot practitioners had a very low follow-through. And what we were able to identify in our region was that when we gave these prescriptions to individuals that went into programming or to walking groups, as an example, we had a higher follow-through, and we also saw, we were able to track those prescriptions, and we were also able to understand what the needs were at a much deeper level. Next screen, please. So going to the community health profile, once we were able to finish our pilot and we were able to understand where most of these prescriptions were going, we had set the number to be 70 prescriptions. We ended up having 125 prescriptions that went out. We tracked them for 7 months. And what that pilot project allowed us to do was we were able to use the information from the pilot and match it up with what we were learning about our neighborhood community health stats. We were able to line it up with the demographic data that we got from the Census Bureau, and then we were able to compile what this community health profile would look like and how we could move forward with programs and or making the ParkRx project for Bonner County residents a more successful tool that our practitioners could use to help their clients achieve a higher level of health. Next slide. So back to the pilot, after we finished our pilot and we met with all of our practitioners, we then opened up the program to a few more medical facilities. Now, we did not open it up to this entire community because it's a very large community. Even though we're rural, we have a hub community where all of our rural communities come in for health care. So we have around 67,000 people in our region. However, in the actual city, we only have 6,700 people, or let's see, 6,700 people. And these doctors and practitioners are giving everybody in this region service. So what we found out in this was not only that these doctors were very clear on what our highest crisis levels were, but we also found that our community health profile lined up with our CDC report and our county health rankings, with the exception of our teen depression and suicide piece. So we're still looking at the purple screen, and I just want to pull this out a little bit for you. Because our pilot program showed us that we needed to go beyond just doctors giving prescriptions in a rural community, that we actually had to create programs to address these different pockets of people in need, we came up with these 4 concepts. One, we have a really high suicide rate in our teens. In the last 4 weeks, we've had 2 suicides in our teen population in just our city, not even the Bonner County. So 6,700 residents, 2 teen suicides, which is very, very high. We're on the CDC's list of needing to watch. We're at very high risk. One of the next critical pieces in our community is that we have an increasing level of obesity, which is also leading to the onset to type 1 and type 2 diabetes. And that was a very big piece in our pilot that we were able to identify not only in our pilot, but also in our community needs assessment. Most specifically, when we went to the CDC information, we were able to pull up information about what was going on in our region when it comes to type 2 diabetes, type 1, and obesity, not only in our adults, but in our youth. The third piece that came up in our community profiling from the pilot and then going through these assessment tools was we have a we're a resort community, so we have a lot of people retiring here. They're bringing in their chronic disease, also not getting the services that they need to support them. So we have more and more people as they're aging going into isolation, which is making their chronic disease or getting more exacerbated, but also they're no longer contributing in our community. And we wanted to turn that around. Our 4th major population that came through this was also in our pilot, which we didn't really know was going to show up, but it was dealing with either single parents or young parents. And what we found was not only did we have a really high level of depression in these specifically young females that were trying to raise their children either with a partner or without a partner, but we also found that their needs for taking part in a community that would support them became a priority for 2 of our medical practices. Next slide. So basically what we were able to do was I became the Park RX champion, or Knitsu Land Trust. We decided that we would house this project. My job is to mobilize all of our teams. I'm also responsible for all the marketing, media, and the promotions, and I also put on fundraising and events. I do grant writing, etc. I also work with boots on the ground, which is, if you look to the right on your screen, I work with university students, I work with our high schools, I work with the students within the high schools that are interested in, let's say, health occupation. I work with student mentors. And then on the other side of the page, I work with making all of our medical offices aware of what's going on, and then we appoint front-end staff or nurses who champion through the medical offices, which has been a critical piece for us because we have, when I'm dealing with so many facilities, if I'm not careful, I can lose track of one or the other. So when these front-end staff staff at medical offices get a hold of me, they can tell me when they're out of their prescriptions, or if they need something to be changed in their programming, or if they need further understanding, or if they're giving me names of the prescriptions of the people that they've given the prescriptions to. That's kind of a lot of words in that statement. We also work with our Parks and Rec very heavily. In fact, all of our programs go through Parks and Rec, so that all of our participants that get the prescriptions go to our Parks and Rec office, they sign up for the programs, and then it's managed through that marketing piece as well. We work with our city parks that are also attached to our Parks and Rec, but we also work with private landowners. Most of the people that have gotten our prescriptions, and we are over 400 now, are still at what we would call level 1 participant, meaning that they need to be on flat trails. So we are very close to where people live in the way that we prescribe our parks, but some of our private landowners are right outside of our communities, and we utilize that space for the higher level prescriptions. On the left side of that page, on the very bottom, we also have inclement weather here, so we work with Home Depot to do walking inside, which is not ideal, but for seniors and for those with some pretty serious chronic diseases, we don't have a lot of locations for people to walk in the wintertime that are maintained. Next screen, please. So when you put all of this together, what we ended up having on the ground, which we launched in March of 2016, were these following programs. We have a Hike 7B. 7B is our license plate numbers that identifies Bonner County, so we call it Hike 7B. That's basically to attract our teens who are kind of hip on anything 7B is a hip thing to do. So we have a hiking program for them that the doctors can give prescriptions to. And again, since we have a very high depression and suicide rate for teens, this hiking program is critical. It's part of our after-school programming, but it's also weekend programming. We have a Walk 7B, which is open for all of our general population. We do it in the morning and we do it at night. And again, we do it in the inside when we have really bad weather. We also have nature walks that we have open mostly for our school-age children, but believe it or not, we have more adults now signing up for that, such as bird walks, etc. And going back to that population of single young parents or parents that are young that are going through stress, in response to their pilot, we went ahead and created a story walk, which is a wonderful idea that came out of Vermont. And basically, that's taking apart storybooks, putting them out on trails so that children and their families can walk through the park and get some exercise while they're also reading. So we partnered with our local library and all of our cities that are around us, and we have one in each one of those communities. And then we also have stress reduction packages that are after school for our kids. So our entire community now is working together for after school programming so that when these doctors are dealing with their youth, they can actually prescribe after school programs for these kids that are targeting not just depression, but dealing with chronic disease of obesity or what have you. These doctors now can use those after school programs as part of their prescription, and these kids get the prescription and the programs, and they stay in those programs until their doctor feels that they can go to a higher level program or until that child wants to be moved into another after school program that's not related to this, but maybe a higher level function. And that's it.
Thank you so much, Suzanne. And thank you to all the presenters for those wonderful presentations. As I said earlier, every park prescription program is so different, and we just heard from 3 very different programs, but they're each very tailored for their community and clearly very beneficial to their populations. Many of you have already submitted some questions, so thank you for that. We're going to go ahead and start the Q&A portion of this webinar. You can see there's Suzanne's contact information for anyone that would like to jot that down. We'll leave that up for a couple seconds. So please go ahead and type any questions in the questions box, and I'll be monitoring that. If we don't get to all of the questions, we will be tracking those, and we'll be adding that to a list of frequently asked questions, which you can access on our parkrx.org website with their respective responses. So the first question will go to Charm. Our third webinar presentation is going to be focused about evaluation, but we're going to go ahead and ask this question. Charm, a question came through on how you define success and what are the metrics that you use.
As far as defining success, what we really try to do is make sure that in any community we have good partnerships, that there is sustainability, and funding for longevity of the program. We also want to make sure that our healthcare providers are on board and willing, as Dr. Zarr, mentioned, thinking about it in a longevity piece of really making sure that the patient is. And as far as metrics, that has been very, very difficult for us to kind of wrap our arms around because of so many different communities and ways that they track it. We are working with the University of New Mexico medical students to work on hopefully gathering some of that information because they have been so instrumental in developing walking programs at different clinics. But we also have to be very cognizant of their schedules, and so it is a work in progress. So as far as that goes, we're still working on it and trying to come up with what we consider a good evaluation as how we measure the program.
Thanks, Charm. The next question goes to Robert. Robert, can municipalities and parks outside of DC use dcparkrx.org to create these applications for rating their area parks? In addition to that, how frequently is the park database updated, and how confident are you in the ratings, trail quality, etc.?
Yeah, it's a great question. So, the first half of the question is, can municipalities outside of DC actually tap into this and use it? And the quick answer is yes. There's really nothing stopping us. We've actually already been doing that. So if you actually go to dcparkrx.org, you'll see that we have 821 parks, I believe, that's in the database right now that's usable. And a lot of those parks come from Montgomery County, which is in Maryland, so it's not DC. We're adding parks from PG County as well, Prince George's County, Frederick County. And so we're actually already in the process of expanding as it is. And unlike what Charm is doing, Charm has done an amazing job with rating. What I'm finding in my experience is that it's not so much about rating parks anymore. That's how we initially started in DC as well. It's about really partnering with the park agencies who want to. So, and when I say that, I mean anywhere in the U.S. where there's an urban area with parks and with people who are suffering from chronic disease or propensity for it. So that's everybody. Can do this now, and what it means is developing the relationships with those park agencies, get those attributes in the format which we have that is actually relevant and easy to use for the docs. So it's not so much about rating. And so then the next question is, is the data, the quality, the accuracy of the attributes, is it updated? Well, we lean on the park agencies for that, right? So once we establish a relationship with them, then the onus is on not just the park agencies, but also on the users. And so we see as we sort of fully develop what we are experimenting with here in the Northeast, we see a day relatively soon where users can actually help us really identify the kinds of attributes that, are what people are looking for, and to help the database in general be updated by the users themselves. So the way I sort of see this, sort of the futuristic model of this is certainly leaning on the park agencies who already own that data anyway, as well as on the potential future users of that park space as they're being prescribed parks.
Thanks, Robert. Our next question is for Suzanne. Suzanne, how frequently are the nature walks scheduled? Are they at a consistent time and location? And how do doctors tell patients where to go for the nature walk?
Oh, great question. So I'll answer the last of this first. My role is every time new programming is available, I get that new programming information into each medical facility, and I give it to my person who I connect with, either it's the front end staff or the nurse practitioner, so that they then put it in the files for those people that are giving the prescriptions out. So all of that information is updated once a month, and so hopefully we get it usually in a uniform way so that they have a whole list to choose from. We do nature walks depending on the season. So like in the spring, we do a lot more nature walks because there's a lot more of exciting things going on in our region. You know, life is starting to wake up, and so our biologists and our people who are leading those walks are able to find a lot more of interesting things. Of course, we do them every weekend in the summer, and I shouldn't say of course. We do lead them in the summertime frequently. It's not just our organization, but organizations around here. We tap into all of that. And in the fall, we tend to go less frequently. So right now we're doing twice a month. And probably in the late winter, when it's really nasty outside, we'll do inside presentations, which then are those still are something that doctors can prescribe, but it's not a movement type thing. So it's about twice a month in the wintertime, and it's weekly in the spring and summer.
Thanks, Suzanne. This question is for all, so whoever would like to respond to this, please chime in. How do the parks and healthcare providers address the liability risks for potential injuries during these activities?
That's a good one.
If you don't mind, I might jump in with that. So this question does come up once in a while, but it's actually not, you know, being a doctor and knowing thousands of doctors, you know, it's not a question that actually comes up as frequently as often non-medical, non-public health ask about. And you know, I think that doctors already have these established relationships with their patients. They supposedly, you know, they should know them well enough to feel comfortable making a prescription for a park or some other intervention, and they should already be assessing the risks to them. So, you know, we make all kinds of recommendations throughout the day to our patients that always involve some risk. This idea of liability and risk is not new to anybody in the health profession, and we deal with it the same way we deal with any other intervention that we do. If we are recommending a cardiac catheterization, you know, we have to go through those risks and benefits with our patients, whether you're recommending it, whether you're performing it. So the same is true for the parks. I mean, we make those assessments throughout our daily routine of seeing patients.
And I'd like to add on to that, Robert, if that's okay. This is Suzanne. Because we are so program deep in our ParkRx program, the reason why we partner with Parks and Rec is because when our programs go through Parks and Rec, they are automatically insured through the city because our Parks and Rec is attached to our city. And that means that all of the people, all of our volunteers that are involved with those programs, that they are also insured. And then as a entity that's promoting ParkRx, we ended up getting more insurance to make sure that our organization is also protected. And then we are in contact with all of the landowners that we have people on the trails for, because we understand that we are doing a little bit different than what Robert and Charm are doing. You know, those guys are giving the prescriptions out, but we're saying we're going to receive the prescriptions and we're going to take care of it from there. So our liability, according to what we needed in our region, did go up, and that's why we put it under Parks and Rec, so that everybody that's involved would be additionally insured through the city insurance.
Great, thank you. The next question is also for anyone who would like to respond. When the ParkRx champion is on the Park and Rec side, what are some tips for effectively engaging and persuading healthcare professionals to collaborate on something like this? Or are they generally very receptive?
This is Charm, and I'll answer a part of that. Well, anyone else can chime in. But what we have found is that our physicians are very much engaged and very interested because they need more tools in their toolbox. Chronic disease is a huge part of what they deal with on a daily basis. And so really getting out and supporting what is going on out in the community as far as parks, et cetera, you know, and think about the physicians and their family live in that community as well. So they want healthy people and healthy parks, and they want to be healthy themselves. So we've found not really difficult issues in teaming up with Park and Rec and our healthcare professionals.
And coming from the Park and Rec program side, what we have found is that because, again, we're a rural community and we have a lot of people coming in, our practitioners have basically told us that they spend about 15 minutes per client, and that's a max piece. So what they've really asked us to do is that we take more of a leading role in making sure that we're always in front of them, so our role is to make sure that, like, once a month we go back into each office and make sure that out of sight, out of mind does not become part of what we've worked so hard to get going. So we engage with the doctors once a month to make sure that they're continuing to have everything they need, but that they don't forget that this is part of their toolkit as they're going forward. We do have some medical doctors that are able to champion this as gracefully and beautifully as Robert does and what Charm is referring to. But what we have found the most part is that they're very excited about being able to use the tool, but due to their lack of time and their heavily burdened schedule, it helps if we continue to engage with them and keep them enthusiastic about it.
If I could add as well, I mean, you know, for better or for worse, like, doctors listen to doctors. So, you know, finding opportunities where, you know, doctors have to be anyway for scheduled meetings, for in-staff meetings, for in-services, for trainings, for continuing education activities. Those are the places to try to reach them. So, you know, and we actually do have a fairly robust list of doctors around the country who are champions, or at least who are prescribing. So if you want to reach out to me personally, you have my email, reach out to me, and I can see if I can help identify somebody in your region. Maybe we already know, might be able to maybe spearhead some kind of opportunity to get doctors together to listen about this.
Great, thank you. The next question is also for anyone who'd like to respond. Do the patients have to pay for the program? Is there any opportunity for insurance providers to help pay for them?
Well, in general, patients don't pay for this, right? I mean, so as I mentioned in my slides as well, we're looking at areas of the country where green space is fairly equitable and fairly accessible. So, you know, this shouldn't require money. Now, as it turns out, you know, sometimes you have a patient with a very particular interest in mind, and so that interest is only going to be satisfied at a park that's not within walking distance, and it may require driving, maybe some kind of, you know, a non-human transportation to get there. So I think that's a role where the insurance companies could definitely play, you know, a significant or have a significant value is covering the transportation to get there. You know, and if it is a place that requires a fee, to cover that fee. I think that would be a really important role for the insurance company.
Mm-hmm.
Great. We're going to ask one last question for anyone who would like to respond. How willing do you find patients are to use prescriptions if they currently do not exercise?
I can address that. We found that our prescriptions in the very beginning we had no idea who they were going to go out to, other than we had asked them to give them out to people that were dealing with chronic disease. And what we found was well over 75% of our prescriptions went to people who do not see the outside as a benefit to their current living conditions. So they use the outdoors to get them from their couch to their car to their doctor and back, or shopping or whatever. But they find the outdoors as a hindrance. And so creating an opportunity for them to get outside was probably the largest obstacle that we had. We learned really quickly that most of these people didn't even know where the trails were, let alone what to bring, let alone what kind of shoes to wear. A lot of them had a high level of anxiety about being outside, specifically because we were dealing with more than one chronic disease at a time. So let's say our diabetic patients that were dealing with one or more chronic disease, they were very uncomfortable being away from bathrooms or being away from, you know, their testing kits or what have you. So we found that there was a lot of hurdles that we needed to go through on the land side to encourage these people to get out and do something that they generally did not want to do. And that's in a rural area. And I do want to make it really clear that we are working in rural areas, which is a lot different than our inner city groups. We had to create a lot more support systems in the sense of getting these people to get to the location where they could even get out to begin with, so that they didn't have anxiety about being outside. So for us, it took a much deeper reach in to get those people and then get them comfortable and then get them moving forward.
And I would say from the clinical setting, if I may, Zarr, you know, I would refer to the person who asked this question to visit the stages of change model, because that's something that we really use all the time in healthcare, that if somebody's not ready yet and they're not willing yet, then don't write the prescription yet, right? So there's a work that has to be done, and it might take several visits, several months, sometimes several years to get them on board with something that really is the right thing to do for their health.
Mm-hmm. And this is Charm, and I would just like to say that, kind of what Suzanne referenced is we have people in our community who don't even know that there's a park less than a block away from them. So really it's that, as Robert said, that willingness to change, where are they on that scale, and do they know what's close and local to them and easy to get to? I think those are all, reducing some of those barriers are very important for getting people outside who don't even think about the outdoors for being physically active or just even taking a walk.
Thank you so much. And we're going to go ahead and wrap up this session. Thank you to all the participants for your wonderful questions. Again, if your question was not answered, please do check out parkrx.org to see a response to your question. And we hope that you found the information provided on this to be useful to you, as you may either be currently creating a ParkRx program or have one in place, or you're just interested in learning more information about park prescriptions. What you see on the screen right now is some information for you around our National ParkRx initiative and some case studies that you can learn from. If you would like to join the movement and share your stories and your contact information, please do provide it in the link that you see on the second bullet on the screen. We hope that you do join us for our final webinar on November 16th. That's going to focus on implementation and evaluation. But do check out, if you were unable to attend the first webinar on partnerships, please do visit the website that you see at the bottom of the screen there.
Thank you.
I would like to just personally thank the ParkRx initiative for hosting these webinars. They're fascinating and really educational, I think, for everyone.
Thank you, Charm. There are some resources listed on the screen here, and as I mentioned earlier, on the handouts portion of the right side of your screen, you do have a copy of the slides available to you if you want to access these links. I do want to say a final thank you to the speakers, Charm, Robert, and Suzanne. Fabulous presentations, and to our sponsor, Kaiser Permanente, and to the Institute at the Golden Gate for coordinating this webinar. Thank you to all participants for listening in, and we hope to see you next time.